Hello, everyone. Thank you for joining us today. And I want to say special thanks to Park Communities for inviting us to provide extra special services to the families and members of Park Communities. Our education services are ongoing. My company's name is Affordable Medicare Solutions. My name is Keith Knabb, and we are in North Gwinnett in Suwanee, Georgia. We have been around for 25 years and we have myself and 8 employees. We are the largest provider of Medicare education services in Georgia. We also happen to be the largest Medicare planning agency in Georgia. So all of our services for Medicare advice and helping people to enroll in Medicare plans and manage their plans are free. There is no charge to the families or the members for our Medicare services. So it's a no-brainer. Give us a call at my office and we'll be happy to help you. We provide lots of different Medicare education services, and we have a YouTube channel. It'll be posted in the chat box. There's a chat box at the bottom of your screen that you can click on. You can ask questions, and you can also see the information that my assistant, Raquel Benton, will be placing in that chat box, such as our contact information, phone number, web address, and the YouTube channel. So this is an ongoing subject that we're going to cover today. And we're going to have some positive information concerning the coronavirus and how well Medicare has responded to the circumstances. So Medicare and the coronavirus. SARS-CoV-2 is the name of the virus, and COVID-19 is the disease brought on by the virus. So if you think of HIV and AIDS, well, HIV is a virus and AIDS is a syndrome. It is the what happens due to the virus. So this is a once in 100-year virus pandemic. We have had other pandemics, but this is one that's affected over 200 countries. So it is like the 1918 Spanish flu that went around the world in 2 waves. And it took about 2 years on that pandemic in 1918. Medicare and Medicare plans have responded very quickly to help the members adjust, cope, and save money. And before we get too deep into the coronavirus, I want to do a quick review of traditional Medicare versus the new modernized Medicare, especially as we're approaching the Medicare enrollment season, which starts around October 1st. So remember, Medicare has started to modernize itself since 2005. So the last 15 years, it remained a traditional pathway of Medicare for people who wanted to stay in the traditional side. And they created a new pathway where they have the new HMO and PPO Medicare plans. You do need to understand the vital differences between those plans. And we have a book that we can email you or you can download from our website that helps you understand these different pathways. I teach a 1-hour class on just that subject. But think of this in very basic terms. With traditional Medicare, you get to prepay for your medical events by purchasing a very simple and effective small insurance policy called a Medigap supplemental policy. It just lays quietly in the background, and when Medicare makes approvals and makes payments, Medicare instructs the supplement to pay the rest of the bill. The supplement doesn't talk to your doctor, doesn't talk to your hospital. With the new modern side of Medicare, you actually do have networks that you'll use where the doctors and hospitals do talk to your plan, and you're going to pay when you need care. So if you need to go to the doctor, you'll pay $10 to go see the doctor, or maybe $5. And when you go into the hospital, you might pay $300 each day you're in the hospital for the first week. So it's paying when you need care rather than prepaying. But also with the modernized Medicare plans, you'll receive thousands of dollars of extra benefits. So there's pros and cons to both ways. And that's what my office helps people understand, is the differences between the Medicare pathways. Now, on to the coronavirus. There's a whole bunch of coronaviruses. There's tens of thousands of different coronaviruses. This is one that started in Wuhan, China. And what makes it interesting and dangerous is that it can incubate or grow inside your body for up to 21 days, and you don't even know it. This typical infection time, though, is about 6 days. And before you actually have symptoms, if you ever do have symptoms. So that's the main problem with this virus, is spreading without symptoms. You think you're healthy, you think your friend's healthy, but they're infected. So it's vitally important for those who seem perfectly healthy, feel perfectly healthy, to wear face coverings in public or while near others. I took my mom, she's 80 years old, and my dad, 83, to the Atlanta Botanical Garden last night. And masks are required there. And that was a good idea. And we all walked around wearing our masks. Symptoms. This is another problem of this virus, is that it presents very similar symptoms in many regards to other things, like a headache, a cough, a tingly sore throat, a fever, or just generally not feeling real well, having muscle aches. Well, that sounds like a cold or the flu, or maybe even a bad case of seasonal allergies. But if you do get flu or pneumonia symptoms, that's a bad sign. But the really most interesting thing is the loss of the ability to smell or to taste. If all of a sudden you can't smell your coffee, and that's never happened to you before, that's a pretty good sign you need to go get a COVID test. So watch out for that. That's very unusual, and that doesn't happen with allergies. Even more unusual for this virus is that there are some people who never develop symptoms. Asymptomatic means no symptoms, but it can be transmitted. They actually are infectious. And there's a lot more people that are just pre-symptomatic. They eventually do develop symptoms. So studies have already indicated that it's somewhere around 40% of people who are transmitting without symptoms. And it's typically between the same household members, the people you live with, your caregivers, or someone that you're around with quite a bit, more than 15 minutes at a time. And data shows that about 80% of all infections are very mild or maybe even asymptomatic, but 15% become severe and they require oxygen, and 5% are even critical, requiring the ventilation therapy. So here's the other facts, and then we know these are amazing numbers. 6.5 million people in the United States, almost 200,000 people have passed away. In Georgia, we're approaching 300,000 cases. We're over 6,000 deaths. And it's expected to take about 2 years for this virus to run its full course, just like the original Spanish flu took 2 years. But we've never created a vaccine for a coronavirus. We've created tons of vaccines for the flu and pneumonia, but not for coronavirus. So we have over 100 vaccine candidates in testing right now. And it looks like there's about 30 or more that are into the approaching or into the stage 3 trials. And even Russia and China are already giving vaccines to their citizens. Now, this is not the flu. It's many times more dangerous than the flu, about 10 times more dangerous. And it's more dangerous, of course, for our seniors. So let's talk about that. What have we learned? This lockdown, this shutting down 95% of travel, I've probably had a 90% reduction in the amount of people that I interact with. That has worked better than we expected. And they never done that before. That was incredible. Might have overdone it a little bit in some regards because it was a scary time back in March, April, and May. And then we did learn that children sometimes, very rarely, get affected. About 700 kids so far in the United States. And it's an inflammation disease, very similar to Kawasaki disease, but that's very, very rare. In general, the kids are handling this pretty well. We did learn that using the ventilators and intubation probably was overused. Most people that were getting on the ventilators weren't doing real well, and they've been using steroids, a lot more steroids, and that's been helping people to get off the ventilators. Good news. Very inexpensive steroids that have been around a long time, like dexamethasone. But what we really started learning about this disease, besides it affecting the lungs, it actually is affecting the arteries. It's causing inflammation in the arteries, which triggers the blood clotting factors. So what they're doing right away for people is they're putting them on blood thinners. And this is keeping the lungs from struggling so bad. So this is very, very important. We learned that. It took us a few months to learn it. That's why people are doing better today. And that's why our death rate's coming down. Very good, interesting stuff. Another thing that we've learned, and my own doctor has sent out newsletters about this, a very large multi-office practice in North Atlanta, that vitamin D3 does help. A lot of great information on that. We have a lot of vitamin D deficiency in Hispanics and in African Americans especially, but older people in general need more vitamin D3. Vitamin C helps. They're putting vitamin C in the IV bags, And zinc helps. Zinc is very important for helping you deal with colds and flus and things like that. But before you do any of this stuff, talk to your doctor, because your doctor has to approve of what things you're putting in your body while she's monitoring your medications also. But these are the things that we're learning. Some very simple stuff, but took time to learn that. So we were having an increase in testing recently. We're having a decrease in people seeking testing, but still the cases are going up, but testing is not the reason why the cases were going up. New York, for example, had a giant spike, and right now their test rates are very low in most parts of New York. One part was at 1%. Georgia has been floating around between 8 to 12%, depending on the day, so around 10% on average, and that's not good. You're supposed to be at under 5%, and also Florida has been worse than Georgia at times, but things are getting better. These numbers are coming down, and testing doesn't cause case counts to go up, or the share of the positive test. They actually should go down. So we're really not doing enough testing. We need to do more testing. So I'll give you an example. At the University of Georgia, 800 kids came in sick and 400 were positives. That's a 50% rate. But when they tested 1,500 other kids, just in general, they only found about 8%. So overall, it was about 22% positives in that Athens study last week. A lot of community spread. And we have people together in classrooms, people together at work, people together at events. You're going to have some spread. And we have to be careful going into colder seasons when everybody wants to huddle up for warmth. You got to be careful. So what does Medicare cover? This is important. They immediately said right off the bat, any lab test for COVID-19, you're going to pay no out-of-pocket costs. It's going to be free to you. And also, when your doctor gets these antibody tests, they should have them now to see if you've had the virus a few months ago. You can now do an antibody test for free, and Medicare covers that also. So there's one test that says whether or not you're infected now, and another test to see if you had been infected in the past, and maybe you have antibodies to help you ward off future infections. All medically necessary hospitalizations are covered, of course, because this is a medical illness. But some of the plans have actually been waiving the hospital cost, where they've not been charging people the copays. That's at least on a temporary basis. Talk to your plan. And all the plans also have been instructed that when the vaccine comes out, or more than one vaccine comes out, as long as they're FDA approved, they're going to be part of the Medicare immunization schedule, which means just like the annual flu vaccine and the pneumonia vaccines, that's just going to be covered automatically for free. You need to go get it done if you choose to. Another things that have been really great under Medicare, most plans are offering telehealth, where you can call your doctor or you can do a conference just like we're doing right now online. And most all of that has been free currently. So talk to your plan. It should be a free service to keep you from going out into the public. I've already told you should pay no fees for your testing, but a lot of the Medicare HMO and PPO plans are also offering home delivery of free medical items like sunscreen or Band-Aids or vitamins like the vitamin C and the zinc, antacids and other things, so that you don't have to go to the pharmacy. Some plans offer $30 or $40 per quarter. Some plans offer over $100 per quarter. Each plan's different. The Governor Kemp did a very good job. He worked early on in this pandemic to make sure that people could get early refills from the pharmacy in case there were going to be any drug shortages, to help people to get those filled. We're having some trouble right now with mail order. The U.S. mail has slowed down. There's been a lot of complaints. So if you do need to get it from your pharmacy, see about having them delivered, and talk to your pharmacist or to your plan. And there should be no fees for that. The 3-day hospital rule. It used to be under Medicare, under traditional classic Medicare, that you had to be in the hospital 3 days before they would approve for you to go to a rehabilitation center. Well, that's kind of silly. If they know after a day or two you need rehab, they need to go ahead and send you on over there and free up that bed. So they relaxed that rule to allow the hospitals to clear people out and get them to the rehab centers and free the beds up. Now, we're not doing bad on the hospitalizations right now. We've actually got about 20% of the beds overall are free, But the problem in Georgia is we're about 50% higher than even the next worst state, which is Mississippi. We're at about 14%, they're at about 9%. And so Georgia, even though we've got good bed availability, we still have a lot of people in the hospital compared to our neighbors. And we're in kind of a lull right now between what happened in July from July 4th. And so we're hoping Labor Day doesn't drive that back up again. We're hoping. Let's keep our fingers crossed. Stressful. All of this stuff has been very stressful. And it's just even talk about the subject can be stressful. But just take breaks. Get off the social media. Quit listening to the news and all the negativism there. Get out and do something more positive and stretch or meditate. Also try to eat healthy. They feed you great at Parc. I've had the meals there. They're fantastic. As good as any restaurant for sure. And you should get plenty of sleep. Maybe avoid alcohol or maybe just keep it to 1 glass of wine. But make sure you get some other activities to enjoy and connect to others. My family does Zoom birthday calls. We also have the ability for you to call your healthcare provider through Medicare, where most of the plans are offering free virtual or telehealth mental health services. So privately, you could call and get some counseling if you're feeling overwhelmed or isolated or depressed. Please seek help. And it should be free or next to no cost. Now, here's another thing that's stressful, that you can be a good consumer and you can protect your neighbors and your friends. Watch out for scams. Of course, the scammers are always looking for the next thing to use to scam people out of their money. And they're using COVID-19. They're doing robocalls, offering free masks. They're doing social media fraudulent charity programs. They've had fake testing kits. They've had people calling about the next vaccine manufacturer that's going to go from being worth $1 to being worth $100 million, and get that stock now, quick, send some money in. Emails that are pretending to be from the Centers for Disease Control or the World Health Organization. I've actually seen one of these. But also text messages that says a person you know has had COVID. Well, the problem is the health department was trying to do that with text messages, and the scammers came in and started doing the same thing. So it's very frustrating. I heard another one today, Clark Howard was talking about, was there a lot of the elderly was being preyed upon about a kidnapping, saying, you know, a child or a family member was kidnapped for ransom and please send the money in. So don't get taken in by scams. So will Medicare call you? Now, Medicare is not going to call you. So if someone pretends to be from Medicare and calls you, it only be Medicare if you had called Medicare and asked for an appointment to have somebody call you. Medicare is not going to call you to sell you anything. They're not going to come visit you at your home. Medicare can't enroll you over the phone unless you called them first. So if somebody is calling you and saying that they're from Medicare, they're lying, okay? I don't work for Medicare. I would say this is Keith from Affordable Medicare Solutions. We're a Medicare services provider. Now, conspiracy theories. This has been frustratingly annoying, but also kind of comical. There's a lot of crazy things been told out there. There was a video called Plandemic with a discredited doctor named Judy Mikovits that said this whole thing was planned. It was it's all planned out, and it's not. She also said that the masks, if you wear a mask, it's going to activate the virus in you, or it's going to cause you to have high CO2 concentration in your body. This is all just a bunch of bunk. And another thing that's out there recently was that we're overcounting the deaths by 90% or something, and that's completely false. Of course, we're having an undercount of the deaths because a lot of the smaller countries and a lot of the health departments and places have not been able to keep up. It's been so many that they are missing some. This is really happening worldwide quite a bit. There's a new thing though. I'm getting myself a new 5G cell phone, a really super duper cell phone. And some people say that those cell phone towers are causing COVID. They don't. That's crazy. And vaccines are very good for you and have been very good for society and the world. The reason we have such great modern long lifespans is because of good vaccines. So it's your choice whether you take one. We do live in America. Nobody's going to force you. So let's go back to what some of the Medicare carriers are doing for people. A lot of them, at least temporarily or through the end of the year, are waiving the primary care, specialist care, behavioral health, and telehealth or mental health for part or all of 2020. Some of them actually went back to March 1st and reprocessed old claims where people had already paid their copay to the doctor and were sending people back refunds. That's pretty neat. They're not required to do that, but that was very kind to help out. Some of the plans have actually mailed out face masks. You can see it on the screen here. The face masks are smart. Every insurance plan should have done that. That's the easiest, simplest way to keep people out of the hospital, is to give them a way to have a comfortable face mask. They were sending two, so you could wash one, wear one, wash one, wear one. Very nice, smart move. Wish more companies had done that. Some of the carriers also that deal with traditional Medicare have promised, two of the major ones have promised both new and renewal premium price stability so that people don't get crazy rate increases. If you have a friend that has gotten a crazy rate increase on their Medicare plan, they need to call me. I'll probably be able to save them some money. And that's happened, unfortunately, on a couple of the smaller carriers. Medicare, the government agency, actually put in some special rules and expanded some rules to help me help my clients. And we're expecting probably, if we have another outbreak during October and November, December, if it increases again, that they also may give us some special help. They haven't promised it, but we're expecting something would be done very quickly because that's what they did a few months ago. So here's some resources. My website is amsplans.com. The Centers for Disease Control website is good. The MedicareRights.org, Medicare Rights. If you feel that you aren't getting treated properly or that you deserve a refund or something, Medicare Rights is terrific. And the Department of Public Health for Georgia, dph.georgia.gov. Good website. They've had some changes. They've gotten much better lately, giving out good information. And a lot of the information from this presentation was from these websites. Now, we also have our YouTube channel for affordable Medicare solutions. And these videos are also cataloged there so you can watch them again. Of course, with COVID, we have to update the video about every week because of new information. So thank you very much for joining us today. This is a great pleasure to teach on these subjects and to try to correct some bad misinformation out there in the market, and also maybe relieve some of your stress. Things are getting better. Let's just keep it that way. We're having a nice September. Let's hope it continues that way into October, November, but we can't let our guard down. But call my office at 770-945-5261 if you want to have your Medicare plan reviewed for free in October and November. We can do that for you. Also, if you're under a Medicare HMO or PPO plan, Medicare has now announced that you can also have some time in January, February, and March if you also need to make a change. So remember, we're here to understand those rules and to communicate those to you. If you have other questions, you can email Raquel at amsplans.com. And again, I want to say that all of our services are free for Medicare. So you can email your questions in, and again, it's Raquel at amsplans.com. Thank you very much. Have a great day.